next speaker is Dr.Tamy Faierman. Hi, everybody. Thank you, Tracy. Hi, for having me here. I feel so honored to be amongst these amazing, amazing women, and all of you as well for creating this event and supporting this cause. My name is Dr. Tamy Faierman. You can see my bio, but I'll give you a little bit of feedback or recap a little bit my life. I'm trained from New York at Mount Sinai, and I did my general surgery and plastic surgery at Albert Einstein in New York. And then I also did a hand fellowship. I did microsurgery training, so I did a lot of free flaps and hand replants and all of that for many years. And then got a little busy giving birth to 5 children and realized it doesn't exactly go with microsurgery so easily. So that's when I decided to change my practice from the reconstructive aspect to more of the elective surgeries. That way I could manage my home life, let the kids know that they have a mother that's around, and participate with them, and still have my beautiful patients to take care of and support. So my practice mostly consists of reconstructions, but in a different way, not breast cancer reconstructions particularly. I support women surgically with reconstructions after massive weight loss. A lot of women who undergo 100-pound weight loss, bariatric surgery, or just with lifestyle changes, or just pregnancies and life. As women, we really pay with our bodies to have these beautiful kids, and so sometimes we just need to feel that we are reconnecting back with our physical self. And so those are the surgeries that I do now. In addition, my personal experience, which I'll share with you, brought me to creating a holistic spa and wellness center, and that's a little bit of what I wanted to talk to you about. So I'm making a transition from the very medical part, kind of Western medicine, into more of the holistic approach, which is the emotional part, and then you'll have the lovely Alexia, who will speak more about emotions via therapy. I'm not a therapist, even though I think I am. I think I have a PhD. I keep looking at all my diplomas, like, where did they get a PhD? With all the kids that I have and all my experiences. But basically, a few years ago, my aunt, who was really my soul sister, my best friend, was diagnosed with ovarian cancer. And that was really my first experience with someone close to me with cancer, other than, of course, taking care of my patient population earlier in my career. And it was hard. It was really, really hard when you have someone who you really care for, who's suffering, and you just want to do everything that you can for them. But what happened with her, Miriam, her name was, I learned so much, and it really brought me to practicing and living my life in a different way. And what I mean by that is following a little bit more of what's the Eastern philosophy, which is based on Ayurvedic medicine. Ayurvedic is ancient medicine, really started in India over 6,000 years ago or so. And the word Ayurveda comes from Sanskrit. Ayur means life, and Veda means knowledge. So it's really takes into account the full life knowledge, or the science of life, that we really are living on a day-to-day basis. And the goal of Ayurvedic medicine is to promote health as opposed to fight disease. So it's a very different concept, because as Dr. Stokes and Dr. Karkas told us, we are working very hard through the medicine that we have nowadays here at Western medicine to fight disease, and we must do that, of course, to have the survival rates that we have. And in addition, there is this whole other area that can be embraced, which is wellness through the holistic approach of Ayurvedic medicine, which I'll explain in a second. So back to my aunt, I used to drive her around everywhere to get all these treatments that she was getting. Holistic acupuncture, lymphatic drainage, of course therapies, vitamin infusions, all different complementary treatments. They're not called alternative anymore, they're called complementary, because they're in conjunction with Western medicine, which we still do, of course, the chemo and all of that, and the surgeries. And I used to ask her, listen, you're so tired, you're drained, you're exhausted, this is costing you money, and I love driving you around because we hang out in the car and get to chat, but is this worth it, really? And she said to me 2 things that taught me so much, and I shared this with Tracy's group, everybody who's here from the retreat that we talked about yesterday in my space, in my wellness center. And what she said to me was this: not only am I getting physical relief, that I feel physically better, I feel stronger, I feel relief of whatever aches and pains, but don't underestimate the power of the human touch and the human connection. And that is so powerful. And at the moment I just said, okay, yeah, let's go. We're running late, let's go. At the moment I don't think I grasped the depth of that comment. And as the time went by, it started really resonating for me. To the point that about 6 months ago, in my very busy practice, my very busy life with the 5 kids, their ages 10 to 19, so one in college and getting her all set up, and then the little ones, a bunch of teenagers, a lot of hormones going on. Do you have anything to suppress that, like teenage hormones? We're gonna have to come up with, quiet them down a little, those guys. Very, very busy, but I had this epiphany to create a wellness center. And I think it really was born and came about from my experiences with my aunt, that first-hand experience with her cancer journey. And so that's when I started learning a little bit more about Eastern philosophies. And really what it is the fact that we are body, mind, and soul. We are not just one or the other. We're not just our breasts, we're not just our cancer. We really are truly connected. And that's where we can find a lot of healing and a lot of support through our journey, whatever that is, whether it's a cancer journey or prophylactic, a pre-Viber journey, or something completely different. We all have our challenges. And so there are so many therapeutic modalities that we can look into and find what resonates for each one of us that support health and well-being in the full mind-body connection. And soul also, finding things that really speak to our soul. And that's what's the name of this retreat? Music of My Soul. And that's so beautiful that Tracy named it that, because it really is about finding our passions and what inspire us. What's been found out that through some of these different complementary treatments, like things you've heard of, yoga, meditation, acupuncture, massages, lymphatic drainage, you really are changing the neuroplasticity of the brain, which is that the brain is very malleable, and you actually get increased blood flow and oxygenation through meditation and yoga. They've done scientific studies. In the medical community, that we're all in, when they start doing scientific studies, they're interested because they're putting a lot of money into it to figure out, why is everybody doing this? Why is this so good? So just like Dr. Karka said, that walking can decrease your risk, which is unbelievable and such a simple thing to incorporate in your life. Yoga and meditation, among some of the other modalities that I described, can also increase your wellness on a physiological level. Decreases your blood pressure, decreases heart rate, helps hormonal stabilization. Now, if you go with a cancer diagnosis to one of the big centers, Sloan Kettering, even Memorial down here, you will get a chemotherapy prescription, and in the other hand, you're going to get an acupuncture prescription, because there are now studies that show that acupuncture decreases nausea and vomiting. There are some studies about insomnia also, and anxiety, along with your diagnosis. So I think this concept of promoting health versus just fighting disease is so critical, and we can do it both. We can fight with everything, but why not also be proactive? Proactive in our lives, showing up in our lives to actually go and create that wellness for ourselves. And we don't have to wait for a diagnosis. Some of us do have the gene or the diagnosis, and that's fine too. And that sometimes wakes us up, or like for me, it was my divorce 6 years ago, and then my aunt who had the diagnosis, and then my oldest daughter with depression and anxiety and self-harm. I mean, those are things that kind of slap you around a little bit and wake you up and say, hey, look at what you're doing. And how you're living. But we don't need to wait for that, and we can just go on our merry way and have these beautiful lives without major drama, but actually be proactive. Because the beautiful thing is that when we start incorporating these wellness strategies for ourselves, even just a walk or yoga or meditation, whatever fits into your life or resonates for you, you actually end up healing the community around you as well. Because this is contagious, this stuff. You end up living differently, more mindfully, more consciously. You end up raising the awareness of everybody you come into contact with, your children, your loved ones, friends, your patients. And so what I've done is I've created a wellness center in my space, and I actually have workshops, 6-week workshops for youth to teach them wellness through these strategies, and for cancer patients as well. And I corroborate and collaborate with cancer doctors, oncologists, to help complement all of the treatments that they're doing with their oncologists and their surgeons as well, and then help them have the other piece of it, giving them the confidence that Tracy spoke about, so important, becoming proactive in their lives, in finding their passion, finding themselves and their strength. We do this through art, through music, mindfulness techniques, yoga, meditation, really fun stuff. Of course, nutrition and exercise is critical as well, looking at the emotionality of that. So I just invite you to become proactive in your life. It'll help those around you, it'll help you as well, with or without a cancer diagnosis or a BRCA diagnosis. We can all bring something positive into our lives and therefore affect the communities around us. So thank you, Tracy, so much for creating this day, and to all of you for coming and listening. Thank you.